Hey, wow. That's some big change there. Please lower the volume for me. Young people for... Good. Last time, young people for... Okay, my name is Kafui Day. I'm a journalist at Ghana Television. I'm a former adolescent. And I'm here with, well, she'll introduce herself. Please come. Let them see you.
I'm Dorothy Sewa, second year student of New German Senior High School, the assistant MC for the program. Thank you.
Thank you very much. Put your hands together for her. As you can see, she's the adolescent. I'm not, but I'm a former one. So I think I know how it feels. Quick announcement. We have the washrooms. When you step out of the room on the left, you will see male and female. So that's where the washrooms are. We want to populate the high table with our panel members. So if you know you are a panelist, please come up and promote yourself to the high table. All the panelists, you will know their names later on. So there's a panel discussion that is happening. So all panelists, please join the members on the high table.
Okay. Please, you're welcome to National Forum on Adolescent Health and Wellbeing on today, 13th September 2023. And the theme is Young People for Change in Ghana. Here in the Greater Accra Regional Hospital Conference Room, please you welcome Mrs. Selma Opoku Adomako for an opening prayer.
Hello, everyone. Please, shall we bow our heads in prayer? Lord, our Heavenly Father, we thank you for today. We thank you for the organization of this program from the inception till now. We thank you for bringing us here safely. Those on the way, we pray they come and reach us safe and sound. We commit the whole program to your care. We are praying in Jesus Christ's mighty name that you take absolute control. May what we are coming to do be to a successful end as we wish and desire, as has been set up from the beginning. May it be the best we can ever have. And as time goes on, may we continue to implement whatever we get from this program to the glory of your name. We bless and thank you in Jesus' name. Amen.
Thank you very much, Mrs. Adomako. So we are grateful to the International Pediatrics Association, the Pediatric Society of Ghana, the Ghana Health Service, Ministry of Health, for putting this very important conversation together on young people. It's a national forum on adolescent health and well-being. We're going to have a couple of opening addresses. The first will be done by the president of the Pediatric Society Ghana. Let's welcome Dr. Hilda Mantibia Boy.
Good morning, everybody. High table, I greet you. Thank you to everybody who is also joining online. It's such a pleasure to be here today. We, the Pediatric Society of Ghana, are very happy that we are the ones who have been able to put this together first this year. And this is part of efforts to improve access to health for adolescents in Ghana. The International Pediatric Association tasked us, the Pediatric Society of Ghana, to hold an event, that's this one, as part of efforts towards the Global Forum on Adolescent Health. This will be held on the 11th and 12th of October. So this is one of the very first events that is happening in Ghana. There'll be a few others, and then in October, the Global Forum will happen. What is this about? Essentially, we are trying to improve the awareness or increase the knowledge base of people about adolescent health and well-being and the need to prioritize them. We have in Ghana close to 7 million adolescents, young people. So from 10 to 19 years and 20 to 24 years, the post-adolescent phase. We have in all Ghana about 7 million. That's a huge number, isn't it? And together in this room, we have more than half of us all being adolescents. How I wish I was still this young anyway. So today it's about the adolescents. It's all about creating the awareness. It's all about bringing key stakeholders together to discuss ways of improving the health and well-being of adolescents. We are very grateful to the Ghana Health Service for partnering us, Ministry of Health, and all our other partners, UNICEF, there's a tall list, which I'll acknowledge again later, for helping us and making this possible. We appreciate you also for making time and joining us. And those online, hello to you all. Thank you. We hope to have a very good program, and we believe that you will all engage, you will all participate, especially the young people, so that it's not old people telling the young people what to do, like it always happens many times. So this time, we want to hear the young adolescents. We want them to speak and tell us what they want so that we can help them to get it implemented. Thank you all again for joining us. On behalf of my team, we celebrate you all young people. Thank you to our partners. Let's have a good program. Aiko.
Please we welcome Mr. Simon Awak Badek, the head of PPMA and management member, Greater Accra Regional Hospital.
Good morning to everybody. The president of the Pediatric Society, all the members on the high table, and the people we are here to celebrate, the youth, young people. Let me stand on behalf of the medical director of the Greater Accra Regional Hospital, Dr. Emmanuel Sofino, and for that matter, the Ghana Health Service, to express our heartfelt gratitude to the organizers for choosing the Greater Accra Regional Hospital to host this momentous occasion. We in the Ghana Health Service, as a matter of policy, has made a conscious effort to ensure all facilities dedicate a unit to care for these young people. Particularly in the Greater Accra Regional Hospital, we are blessed to have a vibrant, effective unit managed by Dr. Banker to care for our adolescents. So this is to tell you that in all that we do, we know in every country, the young people are those that can propel the developmental agenda, whatever it is of that country. So we in the Greater Accra Regional Hospital and Ghana Health Service are very happy to participate, to support this call by the Pediatric Society's president to create awareness, to ensure that our society pay serious attention to our young people. once again, since the day is meant for our young people, let me not spend more time, but to welcome everybody to this momentous occasion, so that at the end of the day, we will have our objective of promoting the health of our adolescents to a very high level. Thank you so much. I'll pause here and welcome all of you once again.
Thank you very much, Mr. Awog Badek. There are a whole host of schools I want to introduce before the next speaker. So if I mention the name of your school, just stand up and give us a wave. Osu Presby Girls Basic. Salem 1 Basic. Osu Salem Road Basic. Osu Ringway Estate Basic. St. Barnabas Anglican Basic. New Drabian Senior High. Thank you. Thank you. Now we are going online and we'll be hearing from a health specialist from UNICEF, Dr. Paul Jani Edu. He's online right now. Dr. Jani Edu, we are reaching you live from Greater Accra Regional Hospital. Can you hear us?
Very well. Good morning to all of you. Please, can you hear me?
Dr. Jani Edu, can you hear us?
Yes, I can hear you. Please,
Please,
can you hear me?
volume. Yes.
Please, can you hear me? Hello, please, can you hear me?
Yes, we can hear you, Dr. Jani.
Great, thank you very much. I wish to stand on the existing protocol to bring greetings from our country director at UNICEF and the entire UNICEF team in Ghana. And I wish to congratulate the Pediatric Society of Ghana for putting together this initiative. UNICEF is proud to support this initiative to join the 1.8 billion Young People for Change campaign. Now, the adolescent period is a critical stage of physical and psychosocial development, which transitions into adulthood. And according to the SDG targets 5.3, we hope to aim to eliminate all harmful practices, including child marriage. UNICEF has continually worked in consultation with government ministries, NGOs, professional organizations like PSG, and adolescents themselves to provide comprehensive, socially safe, and gender transformative interventions for adolescents in Ghana. And over the years, we have collaborated with partners on the global program to end child marriage, to implement interventions that will promote the rights of adolescent girls and to avert marriage and pregnancy, and to enable them to achieve their aspirations through education and other alternative pathways. One strategy that UNICEF has used with the support of the Ghana Health Service is a safety net intervention, which seeks to create adolescent safe spaces in all health facilities for the peculiar needs of adolescents. As you're aware, Ghana's adolescent pregnancy rate has stagnated with an estimated 15% according to the 2022 Ghana Demographic and Health Survey. Personally, earlier this year, I had the opportunity to interact with an 18-year-old Ama who is a beneficiary of the safety net program being driven by safety nets through the Ghana Health Service. Ama's elder sister had gotten pregnant at the age of 15 years and dropped out of school and was made to go and live with a man who impregnated her. When Ama got pregnant herself, she was in the junior high school, and having this background history in her family, Ama had no chance of realizing her potential of going to school to become a nurse. Through the Safety Net program, healthcare workers identified her and provided her with targeted antenatal services. Amma was supported to have a safe delivery and was connected to the social welfare office in the district for social support. And she was linked to the health authorities, the education authorities in her district. That allowed her to continue her education. In fact, after delivery, she was offered adequate support in school to even breastfeed her baby during school hours. So with continuous follow-up and postnatal care, Amma accepted contraception to avoid other unintended pregnancies. I must say that Amma is now in a senior high school and is empowered to achieve her dream to becoming a nurse. She participates in adolescent group meetings in a community clinic to share her story to encourage other girls in the community to be able to realize their dreams as well. And so we see that by building the capacity of health staff across the country, we've been able to create shifts in attitudes within communities, empower adolescent girls to direct their own futures, and to strengthen services that allow them to do so, including reproductive health and social protection programs. We get the opportunity to reduce maternal deaths of adolescent mothers and also the newborn deaths of teenage pregnant mothers. Finally, as I conclude, I must say that with the occurrence of regional humanitarian crisis in West Africa, Ghana is dealing with the spillover of migrant groups, particularly in the northern parts of the country. UNICEF already is making interventions on education, social protection, and health to support adolescents in these areas and this population. And we need to be intentional together to be able to provide support to these adolescents among these populations, migrant populations. There are 3.3 million adolescents within the age of 15 to 19 years in Ghana. And together we can make them safe to realize their potential and to contribute to national development. Thank you all very much, and I wish you a successful event today. Thank you, and over.
Yes.
We also welcome Dr. Navin Taka, the IPA president of the program.
Thank you, Dorothy. Dr. Taka, can you hear us in Ghana?
Yes. And thank you so much. Thanks.
All right.
Yeah. Hello. Can you hear me?
Oh, I thought you were on a second mic. That's improvement.
We can hear you.
Yeah. Okay. So thank you so much for arranging this national forum in support of Global Forum on Adolescent by Ghana Pediatric Society, PMNCH, and IPA. I'm so happy to see many of my friends here are joining this, and this is a very good beginning for the adolescent work which we are doing at national level. We at PMNCH level we have a very good partnership at global level, but the purpose of this national forum is to bring all healthcare professional societies together, and with other partner, UNICEF, WHO, young people, and focus on a problem of adolescent at country level and start working together. And I'm sure this will be a very good success, and this will create a good model which then we can definitely work on all the aspect of child health at country level. IPA is on the board of PMNCH, and we have promised that we will replicate this partnership at country level, because that's the where action is at all the 160 pediatric societies around the world. And I'm so much thankful to the office bearer of Ghana Pediatric Society for arranging this, and I wish you all the best. Thank you so much.
Thank you. I now acknowledge one last school here. I don't think they'll allow me to leave. So there's one school that I did not mention. Please raise your hand if you're from that school. Tell me. Osumahia. Basic. And there's another one too. There's a boys' school too. Osumahia. Let's clap for them. Yes. What's the name of your school?
Osu Presby 2 Boys.
Okay, Osu Presby 2 Boys JHS. Thank you. More adolescents in the house. Okay, I think I'm done. I'm safe. They'll allow me to go home. Okay, another one is here.
Agri Memorial Senior High School.
In Cape Coast? Yes, Agri Memorial Senior High School. Thank you. All right. Are we ready for the panel? Are we ready? Okay, so this is a panel discussion that Dorothy and I will be moderating. We'll be covering a whole bunch of areas: adolescent mental health, sexual and reproductive health, pregnancy, cervical cancer, prevention, adolescent health, so many issues. We will be having two representatives from the adolescents to join the panel. Are they here? One representative. Yeah, let the person come forward. Oh, she's here already. Oh, you're here. Excellent. Okay. All right. So can I just have a spot of music? Let me go and confer with my co-MC, co-moderator, and then we'll come back. So just give us a little small music break. You can be taking selfies of yourselves. Those of you who have phones, take selfies. Let people know that you were here some. Okay. Let me consult with my moderator. We are ready to start our panel. There's another school that I have to acknowledge before we go. There's a special school here whose name I have to, yes, I want to mention. So it's Castle Road Special School. Let's clap for Castle Road Special School. Thank you very much. Thank you. Okay, so we can start now. So this is a big discussion. Please listen carefully, take notes, and then ask them questions when we are done. So, Dorothy, please pass the microphone around for everybody to mention their name and where they work. Okay, so one by one.
Hello, my name is Rachel Atta. I'm a student of Methodist University, Ghana. Thank you.
Hello, I am Dr. Betty Bank. I'm the head of Adolescent Clinic at Rich.
Hello, my name is Dr. Selassie Adom. I'm a psychiatrist, Pantan Hospital.
Dr. Hilda Mantibia Boy, Pediatric Society of Ghana.
Dr. Emmanuel Ame, I work at Greater Accra Regional Hospital. I'm an obstetrician gynecologist and also here on behalf of the Adolescent Health and Development Program of Ghana Health Service.
So Dr. Rachel is here. No, so Rachel is a student of Methodist High. So Rachel, and then we have Dr. Selassie, and you are the psychiatrist. Okay. Dr. Hilda is a pediatrician, so she takes care of children. And then Betty. Okay, so what kind of doctor are you? Family medicine, all right. And then Dr. Emmanuel, what kind of doctor are you? They want to know. Ops and gynecology, okay. All right. So students, I'll test you. So Dr. Emmanuel is what kind of doctor? What kind of doctor does he deal with? Well, he's a gynecologist. So women's issues, right? Dr. Emmanuel, and then next to him is Dr. Hilda. What kind of doctor is she? For what? Children. And then we have Dr. Selassie. What kind of doctor is she? What does she deal with? Mental issues, your thoughts, your mind. Okay. And then Dr. Betty, what does she deal with? Adolescent. She's a family medicine, so it deals with family. So we have a good range. So those are their names: Dr. Emmanuel, Dr. Hilda, Dr. Selassie, Dr. Betty, Mr. Kaff, Sister Rachel, MC Dorothy. Are we good to go? Dorothy, please fire the first question. It's a panel. Okay, let's go. What's the first? So we're looking. Yes. So you know who to ask this one to. Yes.
So, what are the most significant barriers preventing adolescents from accessing comprehensive sexual education, contraception, and healthcare services? And how can these barriers be effectively addressed?
You know who's going to answer this one, right?
Good morning, ladies and gentlemen. When we look at comprehensive sexuality educations and some of the barriers that we have observed to be affecting adolescent ability to access it, largely the barriers, one of them stems from the fact that society and the family unit, the understanding of the concept of comprehensive sexuality education. And this barrier stems from the fact that many people think that when we are talking about comprehensive sexuality education, we are talking about getting our young ones involved in certain things that are not acceptable to our own community and our own setting. However, when we look at comprehensive sexuality education, it largely involves the fact that our young people would have access to everything related to their reproductive health, their sexuality, and empowers them with the ability to be able to navigate themselves through that stage of life so that they don't fall into some of the problems we notice at this time, such as adolescent pregnancy. You find out that they have to drop out of schools. So in Ghana, for example, comprehensive sexuality education has become a very thorny issue. I remember some 2 to 3 years back, there was this attempt that was made to integrate comprehensive sexuality education into our curriculum and into our educational system. But we had a backlash largely because of the assumption that we were bringing in what was being done in the Western world into our own environment. However, that's not the truth. Rather, the comprehensive sexuality education we have in Ghana that was being planned was one, it was age appropriate, which means that the things that will be discussed for someone who is 11 years old is quite different from those who are 19 or those who are the age of 9. And so the barrier largely stems from our community, from people, opinion leaders, stakeholders, including the parents. You find the religious groups are also involved. And that has been one of the major barriers. When we also look at another thing that is a barrier is the fact that parents who are supposed to be the primary person to introduce young people to their sexuality education are not taking their rightful role. I remember doing some research back in 2013, and I looked at sexual communication between young people and their parents. Most young people want their parents to be the first person who will have that sexuality education with them. But when you look at the other side of the fence, which is the parents also are not well armed or have the right information, or even find it very difficult to introduce those young ones to it. And because the parents don't take their rightful role, or they don't even have the understanding, the way to go about it, the young ones are left at the expense or at any other person. And so they get the comprehensive sexuality education from their friends who may not have the right information, or people who have influence on them, and then they end up having the wrong information. Another barrier to it is that to be able to carry it out, even as we had intended to do in Ghana, you need the teachers to be well equipped with the information to be able to take the students through it. Largely, that was not there. Well, and that had that has been a problem to the comprehensive sexuality education, because some of the teachers don't even, they're not well equipped to pass the information. But with what was planned, and we hope that probably we will get it together after we've engaged the stakeholders correctly, the teachers will be well equipped because they would have gone through the training on how to deliver it. But largely to say, parents are not well equipped to do it. There's a misconception about it from people who are stakeholders and of influence. And these things have all worked together to add to the barriers of comprehensive sexuality education. But we do need it. And once we equip our young ones, they can be able to, on their own, overcome some of these issues that are related to sexuality and education and some of the misconceptions, and it will be addressed. Thanks.
Thank you very much, Dr. Emmanuel. Does anybody on the panel have something to add to what Dr. Emmanuel said? Okay, so Rachel wants to say something, maybe Dr. Betty too, who knows?
Okay, so I wanted to add that maybe the young ones are willing to do it because they have a little knowledge about it. And maybe I am 17 and I want to go for contraceptive. But because I'm not yet 18 and I'm not seen to be able to take care of myself independently, maybe my mom is needed to be there to sign the consent form before I can go through that process. So if some of these consents are eliminated, it will help the young ones to do what they want to do.
Okay, so thank you, Rachel. Actually, the legal age that we talk about for consent is 16. And the policy is that really, if you're a young person and you want any information about sexual health or contraceptives or anything, you can come and ask about it. from the healthcare services, healthcare provider, sorry. So really, it's not, as far as that is concerned, waiting for consent just to have knowledge about it. Really, that has been taken care of now.
Brief one, then
With regards to the knowledge, at any age you can get it. Access to service, you can get into any of the reproductive health you need and have access to contraception. The consent of your parents is not needed for that. You can access the service within the policies of the of Ghana. Thanks.
All right, Dorothy, what's the next question?
So the next question is, what are the long-term consequences, both physical and emotional, of early sexual activity and unintended pregnancies in adolescents? And how can we develop targeted interventions to mitigate these risks?
Let me start with the emotional. So, Dr. Selassie, I'm coming to you. Yes.
Okay. Yeah, so having a child when you are not ready is a lot of burden, even when you are ready in a committed relationship. So we can just imagine a young person who is not psychologically ready to carry a pregnancy and have a baby, have another human being depending on you. So like Dr. Ame has said, the preventive means are better, because once you carry this burden when you are not ready, you have a lot of other things that can happen to you, and includes depression. Just the burden of taking care of a child can be psychologically tasking.
All right, so just to add that for the young people, you see, today you see all of us seated here. You see senior nurses, you see other professionals, key people from various places. I dare say that they decided to have babies very early. So it's like ABC. You start from A before you get to Z. If you decide to start from Z before you get to A, you will have a lot of problems having to rearrange things. Your body is set up to follow a certain order. So help yourself and get there. Otherwise, the depression or the low mood and all the problems, even as adults, taking care of young children is difficult. Taking care of a baby, you will not be sleeping well, you are working, thinking about how to get money for food, to get money, school fees, feeding fee, teachers' gifts and all that, plenty things. So you don't want to start thinking about those things and adding them to your head before you have to add them. So for your emotional well-being, take care of yourself and make informed choices. Like has been said earlier, if you want to have sex, we would say abstain. If you are having sex, then you are able to walk into a family planning or reproductive service provider in hospital and get the support you need so that you don't get pregnant, you don't get sexually transmitted infections.
Thank you.
Also, to my young people, having sex for the first time is a very big decision. Okay, you can decide that, oh, okay, someone is giving me pressure, so I have to give in. I always tell my young people that nobody has died for not having sex. Nobody has died. If anybody tells you that if I don't, I will die, please, it's never happened. Okay, and the reason why we are doing adolescent health is that we know that from when you are a child, we take care of you till you get to adolescent, and then after adolescent, you get into adulthood. So what we are trying to do is to safeguard you, make sure you are safe from being a child through to adolescence to adult. Once you get to adults, then you're on your own. But we need to make sure that you make that safe passage. So we need to make sure that we've guided you to make the decisions that you will not regret in future. If you are sexually active right now and you are young, as the doctor was saying, later on you find out that maybe when you're an adult, find out that, why did I even make this decision? You can't go back. You can't undo what you have done. All right. So that is why we want to make sure that you are informed. You have all the information that you need. Right now, we have different care providers, even the adolescent-friendly corners. We have the even just walking into any hospital, you want information, you'll be given that information. But we want to try to make you understand that that is not a decision that you make lightly.
Want to say something? Or you're good? You want to say something? Something for the boy child. Okay, all right. Why not? As a former boy.
All right. I think that for the adolescent, there's a lot of support. The pressures that you face as a result of peer, everyone seems to be doing it. You are the only one left out. That's not true. There are more people who are not doing it than those who are doing it. Now, I have this pressure on me. I don't know how to cope with it. Are there ways which I can cope with it? Yes. There are supports, there are mechanisms that are in place. If you get to any of the adolescent health unit, for example, like we have in a Greater Accra Regional Hospital, you get that support, how to cope, how to meet with those challenges. How do you navigate through those difficulties you're having because the boys around or the girls are putting pressure on you? Now, back to the question, which is what are some of the consequences of engaging in sex early? Some of the things you face, I'm looking at it from the health perspective as a gynecologist, that if you find yourself that you get pregnant at an early age, you get pregnant. To take care of pregnancy effectively. And therefore, you are likely to face some challenges much more than an adult who gets pregnant. Some of the things a young girl, an adolescent face when she gets pregnant may be the fact that she is more likely to lack blood while she's in pregnancy, what we call anemia. They may also end up having hypertension in pregnancy. Imagine a young person at this age, because you are pregnant, you are now having hypertension. And once you have hypertension, it comes with a lot of problems. Those young people end up going into labor before the time. They may give birth to babies at an earlier stage and more cost. And if you find out why some of the adolescents went there, it's because probably they were looking for love or trying to meet a need. And we've also discovered that in addition to all of this, they are more likely to face a chance of having complication or dying in pregnancy because they got pregnant too soon. And these are some of the things you face during pregnancy. And then you look at the fact that the young girl is likely to drop from school. The family is likely to push that person aside. And once the person doesn't have support program, then there's likely to be a lot of problem. Not forgetting that among the young people who are here today, I'm sure we may have the next president of Ghana here. We may have the next minister of finance. And because of pregnancy, you may end up not being able to achieve it at the time you want to achieve it. It may be delayed. And some people may never actually achieve that goal. So I think that in whatever situation you find yourself, there's enough support. Acts, and there are people around, there are practitioners, there are support groups, there are organizations that will help young people to navigate through this time so that you can become who you want to be in future. Thanks.
Thank you, Dr. Emmanuel, and all the speakers.
Please, now our mental health. What are the most influential early detection and intervention strategies to prevent long-term consequences for adolescent mental health issues?
Hello, everyone, once again. Yes, so for early detection and prevention of mental health issues, we found that community-based strategies work best more than the hospital-based ones. We all know that for adolescents, it's difficult for them to walk in the hospital and start talking about mental health issues, even for adults. So their immediate environment is the school. So if we have good systems in the school to pick up children who are at risk, then it's easier for them to be seen and then referred for help. Some schools even have basic services within the school context where we have counselors who can address some of the issues that the children have. So when the schools have those services, it's even easier because an adolescent will be ready to walk into a school nurse's office or a counselor's office. Some of their own teachers are school counselors. So it's easier for them to approach these people, to talk to them instead of walking to a psychiatric hospital, for example. So we know that these school health programs or school-linked services are better than the hospital-based programs. Nonetheless, even within the health facilities, it's important that all health workers are aware of mental health issues. And any opportunity you get to interact with an adolescent, you talk to them about mental health. So you ask them basic questions about how they are feeling, whether they are using any substances, whether there are any difficulties at school or at home, so that we give them opportunity to talk, for them to talk about their mental health. We also know that some community-based programs also help prevent mental health issues, commonly sports programs. So communities where we have availability of sporting activities, it gives adolescents the chance to be able to do things that will not keep them engaged in a productive way. So if you know that you have to compete in a sport and you can gain national recognition, you can go outside the country to run for the country or swim for the country, most likely you will not end up using substances because you know you will be tested. So we know that some of these programs also are positive, encourage the youth and the adolescents to be engaged in productive activities that will not lead them into other things that can be detrimental to their mental health. Then also strengthening families in general to be aware of mental health issues, to recognize the risk factors. So we know that some of the risks cannot be modified. Like if you carry a genetic risk or you have a family member who has a mental health problem, you can't do anything about it. So what we do is to talk to family members, educate them, so the adults in the families to be aware, so that when there are signs, they are quick to send the adolescents for help. Thank you very much.
Also, I just wanted to add that when we talk about adolescent well-being, we have basically 5 domains that we talk about, and each one, mental health runs through. Okay, so the domains include, let's say, good health and optimum nutrition. So that's physical health and capacities. That is part of what mental health, and then you have mental health and capacities. And then you also have connectedness, positive values, and contribution to society. So there's attitude that is involved in that. There's interpersonal skills, that's also part of it. And they have a safety and supportive environment. And as Dr. Selassie has told us, there are supportive environments for mental health that we can refer to. Then there's learning and competence, and also education and skills, okay? And then there's agency and resilience, okay? We say agency, it means that feeling in control of your actions and their consequences. This is all part of mental health. When we talk of mental health, just in society, everybody thinks that mental health means mabodam or inyeseke. All right, that is not it. We all go through periods of mental health, okay, and mental health issues. So if you are having difficulty in school, if you're having difficulty with your studies, you're having difficulty with your exam results, or someone is bothering you, even at home, all right? Don't think that I'm the only one experiencing this, because we all do, from babies to grandmas and grandpas. Okay, so I just want to let you know that mental health is something that is for everyone, not just certain people. And if you have something bothering you and you share it, that doesn't mean you are, that you are crazy or that you are mad. We all go through it.
Thank you very much, Dr. Betty. Before Dorothy brings the next topic, I'm just curious. Rachel, so when you go and speak to the adolescents, what's the number one problem that you have to handle with as far as adolescents are concerned?
It's mostly about teenage pregnancy, because that's the most common thing that goes on because of and maybe not having enough knowledge about how to take care of yourself if you feel you are ready to be having sex or involving in sexual activities. And also there are other things like people not knowing how to take care of their reproductive health to prevent the contraction of STIs or vaginal infections and others, where people like me who have chronic illnesses or other issues being a higher risk for those problems. So that's why I talk about them most.
This one is a question for all the young people here. If you're a young person here, raise your hand, let me see. All the young people, all the adolescents. Yes. Okay, put your hands down, put your hands down. Now, this is the question. Do you know anybody of your age who has gotten pregnant or has gotten somebody pregnant before? If you know somebody in your age, just raise your hand. I'm not going to ask you the person's name, but if you know somebody in your age that has been pregnant or has gotten somebody pregnant, just raise your hand. Let me just see. So you know somebody who, okay, you know somebody, you know somebody, you know somebody, you know somebody, you know somebody. Okay. All right. Thank you for the information. Dorothy, where are we going now?
Please, a question under cervical cancer. What is the most effective approach for educating and raising adolescent awareness about the risk factors, prevention, and early detection of cervical cancer, especially considering the importance of HPV vaccination? That is the human papilloma virus vaccination.
All right, clap for my MC. While we are waiting for the response, there's a video I want to show all of you, and it has to do with a very important topic for you, the young people, after my little survey. So let's drop that video, and then we'll get the cervical cancer question, and then we'll come to the floor very soon. Yeah. Yoni, okay, all right. So the video is coming up. Okay, it was a kind of a silent video. We are working on the audio. We'll come back. But it was a cervical cancer question, most effective preventive strategies and interventions for addressing for most effective approach for educating and raising awareness in adolescents about cervical cancer, risk factors, prevention, early detection, HPV vaccinations. Who will take this one, please? Cervical. Yes, Dr. Emmanuel, over to you. 2 minutes.
Okay. I think the most effective way is, first of all, to use all forums. We all need to be advocates, recognizing the fact that cervical cancer is preventable, and we begin to do that. So all forums, the Pediatric Society, SOGOG, adolescent health groups. And then the fact that if you look at our second cycle schools right now, we have 540 or more nurses that have been deployed in schools. And their role is to ensure that the adolescents are healthy while they are in schools. And so we can use them as a forum to educate the adolescents on the need to prevent cervical cancer. Most of the cervical cancer is caused by the human papilloma virus, and it is contracted largely sexually. Most people get it. And once it stays there over a long period of time, if it is not addressed, it may progress on to become cervical cancer. And so the primary, for number one, preventive way is what? Avoid unprotected sex, and if possible, abstain. The other key thing which is being done worldwide now is to ensure that all young girls, and in some countries, boys, before they engage in sex, are vaccinated against HPV, which is the human papilloma virus. And it is known that once they do that, it largely prevents them from progressing further to have the cervical cancer. In Ghana, we are still yet to include the HPV vaccination in our national vaccination program, but I believe that some work in progress to do that. So the best way is one, abstain, two, ensure that all young girls and boys are vaccinated against the HPV. Now, sometimes we think that the HPV is only against the ladies, but boys also can have problems later in life from contracting HPV. They can have penile cancer, which is the cancer of the penis. They can have throat cancer. And all of these things with the vaccination, it can be prevented. And I think that we all need to bring our hands on deck and ensure that Ghana starts the HPV vaccination. If you look at around West Africa, most of our neighbors have a national program on vaccination against HPV. And with that, in the next 10 years or so, you find that the cervical cancer rate in those countries will go down. And we need to get that started here in Ghana too. Thanks.
So another important thing I wanted to make sure is that young people over here, sometimes we think is the adults who get sick, is the adults who get cancer, is the adults who get diabetes or hypertension or any of the other diseases. We know that some of these diseases start when you are young. As Dr. Emmanuel discuss HPV virus. It can affect, you can get infected as a young person and develop cancers later. Okay, so you have to understand that even though some illnesses, some diseases are seen in adults, it begins when you are this age.
Thank you very much. Anybody else with anything to say? Yes, Dr. Hilda.
Just also to add that the abstinence is very important and is the absolute way that you can protect yourself from HPV and all the other sexually transmitted infection. It protects you yourself too. If you are unable to abstain, then the barrier methods or the condom use is another way to help protect you. Ultimately, you need the vaccination.
Rachel?
I'm here to speak on behalf of the adolescent, and one of the reasons for us having this is to talk to the policymakers. So I feel like if the pap smear test and then the HPV vaccines are maybe included in the NHS and you are not supposed to pay to get it, then a lot of people will go in for it, because sometimes it's the financial difficulties that don't make people get these things. The pap smear is about 150, and the last time I asked someone, a doctor, about the HPV vaccine, she said the 3 shots was about 750 cedis.
A lot of money. Yeah, it's more. It's even more. Yeah, well, we hope the policymakers are listening and we are taking the message to them. It's a very important message out of the National Forum on Adolescent Health and Well-being. Put it on the national health so that it's affordable. Okay, Dorothy, where are we going now?
This is a question under drug or substance abuse.
The adolescent group.
How can we identify early signs of substance abuse in adolescents, and what are the most successful approaches for providing timely and appropriate support, including treatment and rehabilitation?
Before the doctor, I want to ask my question again. Young people, are you there? Young people for... Thank you. Young people for... Thank you. So if you know somebody who is smoking weed or taking any illegal drugs, just raise your hands if you know. Yeah, we just want to know. We are curious. Yeah. If you know any girls who are doing it, raise your hand. Okay. If you know any boys who are smoking weed and taking heroin or illegal drugs, tramadol, alcohol, drinking a lot of bitters and drinks, hard akpeteshi, apio. Yeah. So Dr. Selassie, you want to talk about the drug, early signs of drug abuse? Yeah, no, I was just doing the survey before I get the responses on the early signs, and then we'll come to you. You want to say something first? Yes.
Yeah, so my friends, for me to see that maybe this friend is engaging in something he or she is not supposed to do, you realize they are restless or they have bloodshot eyes or they act impulsively and they are disoriented and kind of hallucinating and all. And I believe if there is a special care home made for people like this, when you find out that your friend is going through this, maybe you go there and then you tell them this is what is happening and then they can assist your friend. That would be great.
You know the meaning of the word hallucinate? You know, let me tell you, when somebody is hallucinating, he will either hear things that are not there or he will see things that are not there. You know, sometimes when you are walking in the streets of Accra, you see some people having a conversation with somebody. Only they can see that person. That's hallucination. Or they hear things. People telling them things. Yeah, so that's what it is. When they are seeing things that are not, you cannot see, hearing things you cannot hear, then that's hallucination. Dr. Selassie will tell you more. Early signs.
Yes, so it can be very difficult to know that somebody is using substances, especially the adolescents, because by the time they start hallucinating and being disoriented and all of that, that means that it is a bit late. So it takes somebody who really knows them well to observe small changes in them for them to know that, no, this person has, there's something going on with the person. Because you know that in adolescence, there's generally, we will say mood swings, or there's generally changes going on every day. So sometimes the person will be cheerful and happy. Sometimes you just don't know what is happening with the adolescent. They are going through a lot of changes all around them. So sometimes it can be difficult, but some of the things to watch out for. So somebody who starts having difficulties with money. So you notice that they are spending money that you don't understand where the money is going, or they start stealing money. So you have a friend and they are always asking you to borrow small amounts of money. You are not sure what the person is using the money for. And then they start lying about their whereabouts. So they will tell you that, oh, I'm here, but they are not really here. And you also observe that the people around them have changed. So they are hanging out with some friends that you didn't used to see them hanging out around with. Sometimes they will tell you that, oh, yes, I know that this friend of mine smokes, but I don't smoke. Or this friend of mine drinks, but I don't drink. So once hanging around the people who are using, most likely they are also using. Then you can also start seeing changes in their behavior. So some of the things that Rachel talked about, where you see that their eyes look a certain way, or you see their fingertips becoming darker, their lips also becoming darker. So these can be signs of other things. So please don't go confronting people when you see that their eyes are red. It doesn't always mean that a young person whose eyes are red, the person is smoking. Okay, so it's very important not to go attacking your friends when you see some of these things. It's rather be gentle. If you see that they have changed, you ask them questions to know what is going on. Unfortunately, when it comes to drug use or substance use, prevention is always better. It's one of the conditions in mental health that is very, very expensive to treat. And it's out of reach to a lot of people. So when somebody is already dependent, which means that the person now has a condition that we need to treat, the treatment is lifelong. And even when they go for rehab once, it doesn't guarantee that they are well and they will not have the problem again. So we have to do whatever it takes to prevent the person getting there. Because once the person gets there, the treatment is very, very difficult. Just to give you a picture, so currently in Pantai Hospital where I work, which has one of the biggest drug treatment facilities in the country, to have treatment for 1 month, inpatient treatment is 6,000 cedis, over 6,000 cedis, because that 6,000 is just for the residential stay. So there are other costs that are involved. So you can imagine that even for people who are working, it's out of reach for a lot of people. So it is important that we prevent it. So right from people being exposed to it, all the way to even when they are using, you have to make sure that they don't get to the point where they are dependent. Thank you.
Just a short story. So my uncle told me that when they were in the senior high school, there were a number of guys who were smoking. So they went, they got a new recruit, more or less, and went to the washroom area to go and smoke. All they heard was, and then from that time, the guy was never normal again. He started having mental health issues. So there are some people who may be smoking, maybe using all sorts of substances and maybe doing well. You alone, you go and try. You may never go home again. So just be careful and watch who you make your friends, because if you are working with 3 smart people, you will become the 4th smart person. If you are working with 3 smokers, you will become the 4th smoker.
Just before the video, thank you so much, all our panelists. And just before the video and our little break, I just want to pick on what Dr. Hilda said about friends. So 2 weeks ago, my carpenter came to fix a wardrobe in our house. He came with his assistant. And after 2 days of working on our wardrobe, he called me because he knew my wife was a doctor and says, how do I get my boy Kwame off marijuana? I couldn't believe it because Kwame didn't look that old. He was not that old. He's a young guy, probably an adolescent like you. And I said, why? Kwame smokes? He said, yes. For how long? For about 6 years. I asked Kwame himself, so Kwame, how did you start? He said, somebody put marijuana in kati cake. Yes. A so-called friend shared in kati cake with him. And I understand that in some parts of Ghana, they put it in food. Yeah. So he said he had it in kati cake, he had it in toffees, and now he's cake, ice cream. So he's now addicted, and how sad. So please, so-called friends can just destroy your lives. I know personally from a friend who started smoking marijuana when we were in secondary school. By your age, 15, 16. How many of you are 15 years old? Raise your hand. Yeah, 16. Yeah, so he started smoking around that time. Very brilliant guy. I don't know why it's always the very intelligent and very smart people trouble. By the time he died, when he was in his early 40s, he died in a public toilet alone. When I went to the funeral, I was the only person out of my class who came to that funeral. Very, very brilliant guy. In the end, he was just miserable, always asking for some small coins to go and buy the next hit. So please, a mind is a terrible thing to waste. Once your mind is gone, it's going to be very, very hard to bring it back. So please, young people, begging you, this is real. Watch your friends. And while you are thinking of that, please watch the video for me. We'll go for some snack and we'll come back and we'll have all the questions for Dr. Emmanuel, Dr. Hilda, Dr. Selassie, Dr. Betty, and Rachel. Please clap for them. They've done a good job.
So you get up, you mention your name, then you tell me what you know as a problem facing the adolescent child in Ghana. Or if you also have a personal experience, you can share it with the class. Am I okay? All right. So we're talking about the challenges, and we are looking at the possible way of solving these challenges among us. Is that okay? All right. So who is going to start for us? Okay, Brew Grind. You tell me your name, then you tell me the problem, then how we can solve it.
I'm a student of the St. Junior High School. I would like to share an idea about physical and emotional changes at adolescents. One, immorality. Immorality are bad behavioral attitudes which are not accepted in the society. For example, when parents send their children to buy alcohol or hard drugs, they start to engage inside those drugs. So how to prevent it is by children or elderly people to stop selling child to buy drugs and hard substances so they will not contaminate themselves.
My name is Amma Ansi, a student of Presbyterian Girls Basic School. I think some of the challenges adolescents face in life are shyness and lack of confidence to have counseling with their parents. Maybe if parents are able to have one-on-one counseling with their children, it can help them to resolve their challenges they face in adolescence. Because when adolescents go shy, to their parents about certain things, sometimes while minor problems will later turn into major problems, since they didn't get a chance to speak out to their parents and get the necessary help they needed.
My name is Rosemond Omene, and I attend school at Osu Presby Girls Basic. Some challenges I think adolescents are facing are peer group influence. This is due to the lack of parental care and control, and other peers advising their other friends to engage in certain things they don't want to engage in. I advise all adolescents, boys or girls, that they should be able to speak to their parents on what they are facing, and they should have confidence to say no to what they don't want to do. Thank you.
My name is Richard Ofokoto. I attend school at Oshokoli 3 days in high school. Today I am here to talk about drug abuse. Children nowadays are now engaging themselves in drugs because they think it gives them strength and their ability to learn, to focus in their academic exams. Some end up becoming addicts or it affects them negatively. I suggest that health workers and school guidance and counselors to once in a while give us an advice on drug and how it and the prevention of it. Laws should be passed and enforced on drug abuse.
My name is Evelyn Kofi, and I am a student of Osu Presby Girls Basic School. And some challenges that as adolescents we face are during menstruation period. Most of us we find it difficult to share it with our parents. Some parents doesn't have time to ask that also about during the menstruation. So as to find it difficult, so we use things that we don't supposed to such as tissue. So I'll be happy if parents have time for us and the price of pads have been reduced into a lower price. Thank you.
I attend school at Osu Presby Girls Basic. Some of the problems adolescents face emotional problems. Sometimes, especially in girls, they feel like going to have sex or being around boys. My advice is that our parents should help us and educate us on sex education and create games so that we divert our brains from things like that or from engaging in them, that we are focused on what our parents are telling us and know that if we engage in them, we'll be doing wrong things or ending up putting ourselves in problems like pregnancy or dropping out of school. Thank you.
My name is Benita. I attend school at Osu Presby Girls Basic. One thing I want to talk about is pregnancy. One, knowing what is good or bad in the society. Like when someone will say to you, buy this for me, when you're coming, you should know what the person will do to you. One thing is that they should have the courage to tell their parents or their teachers about the problems they are facing, so that the teachers or parents will help them or advise them. So they should pass. The school can also ask and also have guidance and counseling units to help the students through their problems in the society. I have also identified that there are no adolescent groups or clubs in our communities as well as in our schools. Says that these clubs should be formed in our schools and our communities. So adolescents can come together to share their problems and how to solve them.
Thank you very much. So those are the issues. I saw shyness, substance abuse, menstrual issues, teenage pregnancy. Yes, you were following. Good. Who else saw other issues? Yes. What did you see? Immorality. Yes. What else? Yes. Emotional challenges. Yeah, the young people were following. Yes. Peer pressure. Very, very, very important. Yeah, peer pressure. Peer pressure. Shyness is a big deal when you're an adolescent. I used to be very, very shy when I was your age. Yes, it's true. Honestly speaking, yes. Very, very shy. Yes. But the thing about curing shyness is you have to find something that you are good at. When you're good at that thing, you won't be shy again. Okay? So find something that you are really good at doing, and then you do it. The shyness will go. It's now time for our snack break. Don't be shy to eat the fruit. Very nice fruits. Step outside, walk around for a while, go and wee-wee if you have to wee-wee. And then you will come back for the questions. So it's now 11:05. You come back. You can bring your snack here, okay? So come back in 5 minutes. Okay, 10 minutes. Come back in 10 minutes. And then we'll ask them all the questions. Okay, so clap for yourselves. Clap for my panel. Rachel, Dr. Betty, Dr. Selassie, Dr. Hilda, Dr. Emmanuel. Please enjoy your snack break and come back in 10 minutes. We'll continue. Thank you. For those of you who are online, please take a snack break yourself. Go and wee-wee and come back. National Forum on Adolescent Health and Well-Being. We're back in 10 minutes. Many thanks to the International Pediatric Association, every child, every age, everywhere. Ghana Health Service, your health concern, and the Pediatric Society of Ghana, as well as the Ministry of Health. Take a break. We'll be back in 10 minutes. Thank you.
Partnership for maternal, newborn, and child health under the World Health Organization is leading efforts to address the needs of the world's 1.8 billion young people through the global 1.8 billion campaign. The young people of Ghana are not left out.
Every year, 1.4 million people die as a result of road accidents. To improve my well-being, I'm pushing for there to be better roads for our young people to be on. Thank you.
And to improve my well-being, I want the government of Ghana to reduce all the taxes imposed on sanitary pads to allow all girls to be able to access it, to improve our learning and education so that when we are still in the classroom, we'll be able to learn and feel comfortable.
To improve upon my well-being, I would like more police stations to be set in the rural and urban areas.
Environment and sustainability. Therefore, my environment and infrastructure is very important and key when we look at issues of development.
The news team caught up with a group of Ghanaian youth leading the campaign.
Activities or events we take advantage of to mobilize responses include art festival. We also went to schools, Independence Square, where Kamala Harris, the Vice President of the United States, came to present her speech. We were there to take responses.
Young people make up a large number of the population, and so in order for the world to be a better place, the needs of young people need to be addressed. And so this campaign seeks to obtain and get to know what the large number of the population, which are the young people, wants for their well-being.
Someone will even go to the extent of telling me that she needs a bicycle to ride to school because her house is far. Nobody would even think about that, and it's really touching when the kids say everything. You can see that they really want to have a better future and they want to be great people, but then the means and resources are not there.
Responses from the campaign will contribute to the agenda for action for adolescents to lead advocacy for increased commitment to adolescent well-being in Ghana. The campaign, among other initiatives, is part of events leading to the Global Forum for Adolescents in October this year. As Ghana prepares to host its national event in September this year, the youth of Ghana are gearing up to discuss their concerns with government and other partners.
So it's very important for them to get involved because it's really helped the nation or the world to know what young people really want to improve their well-being.
Every young person out there. So you can join youthcommunity.org or follow Young People for Change on all social media.
Placing adolescents and youth at the center of decision making is critical for adolescent and youth development in Ghana.
My name is Emma. And my name is Pamela. My friends and I have joined the 1.8 billion campaign.
The Partnership for Maternal, Newborn and Child Health under the World Health Organization is leading efforts to address the needs of the world's 1.8 billion young people through the global 1.8 billion campaign. The young people of Ghana are not left out.
Every year, 1.4 million people die as a result of road accidents. To improve my well-being, I'm pushing for there to be better roads for our young people to be on. Thank you.
And to improve my well-being, I want the government of Ghana to reduce all the taxes imposed on sanitary pads to allow all girls to be able to access it, to improve our learning and education so that when we are still in the classroom, we'll be able to learn and feel comfortable. To improve upon my well-being, I would like more police stations to be set in the rural and urban areas.
Environment and sustainability. Therefore, environment and infrastructure is very important and key when we look at issues of development.
The news team caught up with a group of Ghanaian youth leading the campaign.
Activities or events we take advantage of to mobilize responses include art festival. We also went to schools, Independence Square, where Kamala Harris, the Vice President of the United States, came to present her speech. We were there to take responses.
Young people make up a large number of the population, and so in order for the world to be a better place, the needs of young people need to be addressed. And so this campaign seeks to obtain and get to know what the large number of the population, which are the young people, wants for their well-being.
Somehow we even go to the extent of telling that she needs a bicycle to ride to school because her house is far. Nobody would even think about that, and it's really touching when the kids say everything. You can see that they really want to have a better future and they want to be great, but then the means and resources are not there.
Responses from the campaign will contribute to the agenda for action for adolescents to lead advocacy for increased commitment to adolescent well-being in Ghana. The campaign, among other initiatives, is part of events leading to the Global Forum for Adolescents in October this year. As Ghana prepares to host its national event in September this year, the youth of Ghana are gearing up to discuss their concerns with government and other partners.
So it's very important for them to get involved because it's really helped the nation or the world to know what young people really want to improve their well-being.
Every young person out there. So you can join youthcommunity.org or follow Young People for Change on all social media.
Placing adolescents and youth at the center of decision making is critical for adolescent and youth development in Ghana.
My name is Emma. And my name is Pamela. My friends and I have joined the 1.8 billion campaign.
The Partnership for Maternal, Newborn and Child Health under the World Health Organization is leading efforts to address the needs of the world's 1.8 billion young people through the global 1.8 billion campaign. the young people of Ghana are not left out.
Every year, 1.4 million people die as a result of road accidents. To improve my well-being, I'm pushing for there to be better roads for our young people to be on. Thank you.
And to improve my well-being, I want the government of Ghana to reduce all the taxes imposed on sanitary pads to allow all girls to be able to access it, to improve our learning and education so that when we are sitting in the classroom, we'll be able to learn and feel comfortable.
To improve upon my well-being, I would like more police stations to be set in the rural and urban areas.
Environment and sustainability. That falls in the environment and infrastructure is very important and key when we look at issues of development.
The news team caught up with a group of Ghanaian youth leading the campaign.
We start in 3 minutes. Please tell your friends to come. 3 minutes.
To include art festival. We also went to schools, Independence Square, where Kamala
If you are a
Harris,
student and you have not eaten, please raise your hand.
Came to present her speech. We were there to take responsibility.
All the students
Young
have eaten.
people make up a large number of the population, and so in order for the world to be a better place,
starting in 2 minutes,
of young people need to be addressed. And so this campaign seeks to obtain and get to know what the large number of the population, which are the young people, want for their well-being.
Someone will even go to the extent of telling me that she needs a bicycle to ride to school because her house is far. Nobody would even think about that, and it's really touching when the kids say this. You can see that they really want to have a better future and they want to be great people, but then the means and resources are not there.
Responses from the campaign will contribute to the agenda for action for adolescents to lead advocacy for increased commitment to adolescent well-being in Ghana.
1 minute
the
more.
campaign, among other initiatives, is part of events leading to the Global Forum for Adolescents in October this year. As Ghana prepares to host its national event in September this year, the youth of Ghana are gearing up to discuss their concerns with government and other partners.
So it's very important for them to get involved because it's really helped the nation or the world to know what young people really want to improve their well-being.
Every young person out there. So you can join youthcommunity.org or follow Young People for Change on all social media.
Placing adolescents and youth at the center of decision making is critical for adolescent and youth development in Ghana.
My name is Emma. And my name is Pamela. My friends and I have joined the 1.8 billion campaign. So should you!
1 minute more. Thirty seconds. Ten seconds. It's time. Hands down. So before we go into the question and answer, we will take some messages. And so we are going online and we'll take a message So Dr. Ada Graham, Vice President, Pediatric Nurses Group, is online, and he has just a 1-minute goodwill message for us right now.
Okay, thank you very much. First of all, we bring you greetings from the Pediatric Nurses Group Ghana. As said by the MC, I'm Dr. Ada Graham, the Vice President for the association. We are much grateful. We want to thank the Pediatric Society of Ghana. They are partners in everything, since we all have the same mission of caring for the young ones in our country and globally. This day is a very great day. We are much happy for the invite. All what we have to say is that, first of all, we want to encourage all participants, whether online or physically there, to feel free and then bring out their experiences, their insights about the comprehensive healthcare or adolescent healthcare services that our panel this morning had even emphasized on, making much interest that not that we are trying to overprotect them, but we are rather helping them in that transitional period to resume back to adulthood in their well-being status, whereby when they do something that they cannot have the opportunity to revise back. And as there is a saying that Medaino is always at late, we're much happy for the forum to come out that we have nurses who are even in schools, who are providing adolescent health services or adolescent-friendly kindness for them, so that these young ones can come at any point in time, especially pediatric nurses. We are much interested in the young ones because they are the future. If we have healthy children in future, it is something that is very great, or a very great impact to the nation. So therefore, we are there today. Tomorrow, who next? It is them. So we are much interested in that. So I want to thank the Pediatric Society of Ghana and all partnerships, especially Ridge Hospital and Co, for hosting this program for our young people. And we encourage them that they should keep on assessing these services day in, day out, and then we are also ready to deliver all our best to them. Thank you very much for giving us the slot and opportunity.
Thank you very much. Thank you, Dr. Graham. And we have another goodwill message. Dorothy, who is it?
The next goodwill message is from Mr. Kusukolate, the Department of Children, Ministry of Gender.
The President, Pediatric Society of Ghana, rep of the regional hospital, doctors present, children and young adults here, ladies and gentlemen, good morning to you all. The Department of Children under the Ministry of Gender, Children and Social Protection is very happy to be called upon to partner with the Ghana Pediatric Society of Ghana in this endeavor. In fact, the child and family welfare policy that we are running with as a country has a objective dedicated to children and young adults. And the intention is that we want to empower young children and adolescents to be change agents and to take their own development into their own hands and make sure that things go well for them, being responsible for their development. And therefore, we are very happy anytime, all the time, to do everything possible in terms of legislative and policy frameworks that will be strong enough for children to survive in the country. So we are very happy and we pledge our support every time. Thank you very much.
Thank you very much, Mr. Latte and Dr. Graham. We're now going to take a video. It's on the 1.8 billion campaign. So please watch the screen as the 1.8 billion campaign video comes up.
The Partnership for Maternal, Newborn and Child Health under the World Health Organization is leading efforts to address the needs of the world's 1.8 billion young people through the global 1.8 billion campaign. The young people of Ghana are not left out.
Every year, 1.4 million people die as a result of road accidents. To improve my well-being, I'm pushing for there to be better roads for our young people to be on. Thank you.
And to improve my well-being, I want the government of Ghana to reduce all the taxes imposed on sanitary pads to allow all girls to be able to access it, to improve our learning and education so that when we are still in the classroom, we'll be able to learn and feel comfortable.
To improve upon my well-being, I would like more police stations to be set in the rural and urban areas.
Environment and sustainability. Therefore, environment and infrastructure is very important and key when we look at issues of development.
The news team caught up with a group of Ghanaian youth leading the campaign.
Activities or events we take advantage of to mobilize responses include art festival. We also went to schools, Independence Square, where Kamala Harris, the Vice President of the United States, came to present her speech. We were there to take responses.
Young people make up a large number of the population, and so in order for the world to be a better place, the needs of young people needs to be addressed. And so this campaign seeks to obtain and get to know what the large number of the population, which are the young people, wants for their well-being.
Someone will even go to the extent of telling you that she needs a bicycle to ride to school because her house is far. Nobody would even think about that, and it's really touching when the kids say it. You can see that they really want to have a better future and they want to.
Responses from the campaign will contribute to the agenda for action for adolescents to lead advocacy for increased commitment to adolescent well-being in Ghana. The campaign, among other initiatives, is part of events leading to the Global Forum for Adolescents in October this year. As Ghana prepares to host its national event in September this year, the youth of Ghana are gearing up to discuss their concerns with government and other partners.
So it's very important for them to get involved because it's really helped the nation or the world to know what young people really want to improve their well-being.
Every young person out there. So you can join youthcommunity.org or follow Young People for Change on all social media.
Placing adolescents and youth at the center of decision making is critical for adolescent and youth development in Ghana.
My name is Emma. And my name is Pamela. My friends and I have joined the 1.8 billion campaign.
Please clap for the video. Young people for... Charlie, this thing should be louder. You've eaten some serious food and drunk some serious drink. Young people for... These people are not young. People know how to make noise. I observe you on your playgrounds. Now we have to make so much noise that all the adults in Ghana will hear it. Young people for... Clap for yourselves.
Please, we invite Mr. Okoama from 1.8 billion campaign to give us a short speech.
Thank you very much, co-MC. The panel, ladies and gentlemen, as the video says, the 1.8 billion campaign, plus this event and other events organized by other partners, all works together ahead of the Global Forum for Adolescents. And for me, working with other young people leading this campaign, it shows that when you listen to the young people, they really tell you what they need. And our work was simple. We asked them, what do you need to improve your health and well-being? And then the responses were enormous. Somebody needs a reusable sanitary pad so that she will not be able to go and buy it over and over again. Someone needs a pencil because he wants to be an artist, so he wants to draw. Somebody needs a bicycle. Somebody wants their parents to listen to them. Just that listening ear. They want that. Somebody wants a teacher to be in their class every day because they go to school and there is no teacher. Somebody needs an exercise book. Somebody needs medicine when they go to the sick bay because sometimes they are out of drugs. The needs vary. Somebody would want their friend who got pregnant to come back to school because they miss them, because as a child, she's automatically become a mother raising another child. When you listen to the adolescents themselves, they tell you the issue as it is, as it affects them. And so as we're all working together to develop different advocacy programs, Ghana Health Service, all the UN agencies, development partners, let's go back to why we are doing this. Is for the adolescents so that we work together to improve their well-being. Thanks to the Ghana Pediatric Society of Ghana for putting this together and working with all partners in this. Thank you very much.
That was a really, really good speech in breaking things down. Sometimes people just need something very simple, for their health and their well-being. Thank you so much. We want to acknowledge the Parliamentary Select Committee on Health, as well as the Parliamentary Select Committee on Gender. Let us clap loudly. They are not here, but they should know. When we send them the stream, they'll know that we acknowledge them. Okay. Now we have questions for Rachel, for Dr. Betty, Dr. Selassie, Dr. Hilda, Dr. Emmanuel. They spoke on so many things. What did they speak on? Do you remember what they spoke on? Raise your hand, small quiz. Yes, if you're students, you must know how to do quizzes. What did they speak on? Tell me. What do you remember from what they said? It's now time for you to ask the questions. Just raise your hand. What do you remember? Or the meat pie took everything away? Huh? Somebody is saying, okay, so what do you remember? Yes. Young people, what did you remember from the panel? What do you remember? So, yes. I want to know what you remember first.
Yeah, so I remember comprehensive sexuality education.
Okay.
That is where my question from. Dr. Emmanuel, you said we need it. That is how you ended your statement. So I captured it as we need it, comprehensive sexuality education. When it came, there was a lot of talk, backlash. But your end, we didn't hear anything from you. This time around that you say we need it, what are you doing so that together with Ghana Education Service, we'll be able to implement it without the backlash that occurred previously, so that together we'll be able to move forward? Thank you.
Just your name, please, and your organization. Just yeah.
I am Kojo Bensa Abrampa from Adum TV and Adum FM.
Okay. So Kojo from Adum TV, Adum FM. Let's take 2 more questions. Young people, questions. This is about you. It's about your health. What do you need for your health? What do you need for your well-being? Mr. Amma put it so nicely, but yours could be different. Number 2, your name?
Please, I'm Betha from Ringway Estate Basic School. Please, Auntie Rachel did mention of consulting people, like when your friend is abusing a drug. So what if that friend is not ready to change? What will you do about it?
Good question. The 3rd question, yes, young man. Your name, your school, ask the question.
My name is Adolescent. I was just room. My favorite food are Bako, Mesa, Fridays, aka 57. The food that community that
Yeah, you just want to know about how, as a special child, like these adolescent health issues, it should be in pictorial form so that in the class, they can also follow us. We teach them in the class.
Yeah, thank you. Yes. There's another hand up. Where's the hand? Okay.
Okay, so I'm Selassie, General Secretary of Diabetes Youth Care, and I do have a number of questions. 8. Can I ask so? Short and quick. Okay, I'm going to try. So first of all, with the curriculum, right? Since you already know the barriers that are in existence, what structures have you put in place to ensure that there's a comprehensive curriculum that covers not just the reproductive health, but then the social issues relating to sexual education? Secondly, I wanted to ask on the prevention, right? So in the instances where prevention is not an option, for example, where individuals who have non-consensual sexual activities, what mechanisms are there that have been put in place to ensure that these individuals are catered for? And then how exactly do you help protect them against the social stigma that comes with these activities as well? Thirdly, on individuals who cannot access the measures that are available at the healthcare facilities, and individuals who are even unaware of the availability of these healthcare facilities, what measures have been put in place to ensure that awareness of these facilities are made known? And then how exactly do you cater, or what plans do you have to address the individuals who cannot access it, even with the knowledge of the availability of these resources? Okay. And then, on the issue of like the provision of counselors in schools, pardon my language, but then usually when you visit these like counselors, most of the things they talk about are either religious or generic. They do not provide any substantial help to adolescents. So it makes them not want to even visit these facilities in the long run. So are there any workshops to ensure that you facilitate comprehensive education for these counselors to be able to make tailored decisions and help these individuals or adolescents whilst they visit them? Also on the issue of vaccinations. So I wanted to ask, does the Ministry of Health have any plans, or has the Ministry of Health made any agenda to ensure that the HPV vaccinations are actually available, especially with the issue that Rachel talked about, with the costs that has actually made it very difficult for individuals to actually get access to it, especially with the severity of the situation? What has the Ministry of Health got to do with that? I'm going to end here for now. Should I continue? Okay. I won't come back to you again for 1 year. Okay, so on the issue of community-based facilities, first of all, those are very few. And even with that, you already mentioned that one of the barriers is the fact that they do not have the appropriate knowledge to be able to help these individuals. So how then is it helpful or effective with the community-based programs? And even with communities, especially in the rural areas that do not have access to these community-based programs, what measures are there going to be to ensure that individuals in the rural areas are not exempted or excluded from these activities? Yes. So the last one I want to talk about. Where did they pass? Okay, so the last one I wanted to talk about is not really a question, but then it's about the fact that we've had similar programs like this, and it's usually about the same questions and then the same answers, but we haven't seen any substantial improvement. What we see is a down spiral of the problems that we are trying to solve. So I wanted to ask, are there any new strategic measures that are going to help ensure that the very same problems that have been consistent over the decades would actually be minimized to a certain degree?
What's your name, please? Selassie. Wow. Yeah. In 30 years time, when you see her running for president, don't be surprised, okay? I'm telling you. All right, so we've got lots of questions here. We need it. Drug user, no change. How do you deal with it? Pictorial information for people with special needs, the comprehensive sexuality education curriculum, issues of quality of counselors, HPV vaccinations, community-based programs, and then real improvement so that it's not just talk shop. Who's going to take the, I think I'll start with you first because the first question came to you. No questions, so you can spread it around, yes.
All right, so thank you very much for all the questions. To start with the question about the comprehensive sexuality education, yes, there's a lot of work going on right now, and it's a large stakeholders engagement. Ghana Education Service, Ghana Health Service, religious bodies, pressure groups, civil society organizations are meeting together to ensure that what finally comes out is well understood, is appreciated, and is done well. And before it's rolled out, everyone that has a stake and a role to play are going to have trainings being done for them to ensure that their roles, they're able to play it very well. So it's not a case that we've forgotten about. Ghana Health Service, Gender, Ministry of Gender, a large group of people are involved in this. So something is going on. And eventually, before its reintroduction, there'll be a lot of engagement, disseminations, and it will be done. Okay. I want to start with the question on HPV vaccination. What is Ministry of Health doing? First of all, vaccination program in nations are actually part of the, usually it's a free service that's provided. Usually when it's a national vaccination program, just like you have vaccination against COVID and all the others. Vaccinations are expensive. Now, I'm saying this because I've been in the forum for Africa where we had discussed HPV. So what is happening is that there are organizations which liaise with country and they go into partnership, and their commitment countries are expected to do so that they can roll out the vaccination. The vaccination models vary from country to country. What is expected is that Ghana, along with those people, will have to meet, bring together their certain level of commitment that is required. That is the stage where we are in Ghana, so that it is rolled out. If we want to do it individually, it's expensive. Actually, a shot now is between 450 to 7. One shot is 450 to 750. And in some countries, actually they are selected now is 2 shots, no longer 3 shots. But in some countries, they do 1 shot. So with the commitment of the government, along with the organizations which produce this vaccine, they come into a partnership and then they roll it out. That is what we are moving towards in Ghana, so that we get it rolled out. In actual sense, the first pilot that was done around Africa was done in Ghana for those vaccines. So that's about the vaccination. About access to sexual and reproductive health. The access we have, if you look at adolescents, they fall into 2 groups, in school and out of school. And their needs are different. And how their needs are being met differs from the different groups. And to support this, Ghana Servicing, along with the Ghana Education Service, the Ministry of Gender and others are working together to ensure this is done. And each one is trying to meet the need of certain groups at certain levels. So some try to meet both the in-school and out-school, and others do that. Now, Ghana Service alone is unable to do that. So that is why we have non-governmental organizations working together. Particularly, the adolescent health corners are there. The various youth groups are there. I remember very well, Amma, who spoke on 80 million, was someone we worked with years back, 1.8 million. We worked years back. And you can see that today, he's a product still driving the issues of adolescents. I think it's about 8 to 10 years or more. We worked with him. And he was an adolescent at a certain time. He has gone on and he's still driving and pushing the agenda of adolescents. So it's a multifaceted approach. We've not been able to reach everywhere, but everyone can take a bit of the cake and address the issue. So, quality of counselors, okay.
Yes, I agree with you on that currently I'm on a project that is talking about mental health issues in schools, access to mental health issues in schools. And that's one of the issues that have come up from the adolescents themselves. We've had meetings with them, focus group discussions, and a lot of them say that they are not comfortable going to seek mental health and sexual and reproductive services from their counselors, which is very sad. So it means that we have a lot of work to do to train the counselors for them to be non-judgmental, because a lot of the emerging issues were not even there when we were growing up. In fact, just this week, I learned a new technology. It's called what? Polycube. I don't know, polycube. Yes, it's a relational arrangement. And just trying to understand it I'm struggling to understand it, but I need to learn it to understand it so that when I've met adolescents in such relationships where there are 4 or 5 people. So an adolescent was trying to explain it to me. And I had to be open-minded to including my facial expressions to make sure that I don't do anything that will look like I am judging them. But it sounded very complicated to me, where in a relationship, there are like 4 or 5 players and some are in same sex, some are in, different things. So they are emerging issues. So we all have to learn, especially those of us who are care provided. So I agree with you. We need to train the counselors so that they don't do advice giving. They are supposed to be receptive, listen, and address the problem that the adolescent comes with. And each adolescent is different. So most of the time, the approach is that we come in as mothers and fathers and we are giving advice, but that's not how we are supposed to do it. So that's a very genuine concern. So we would work on the training from the project that I'm on currently. It's one of the takeaway points. And there's going to be a policy briefing and the relevant authorities will be made aware of that issue. Yeah. Yes. The person. Yes. So that is a very common problem with people who are using drugs. A lot of the times they will downplay the amount they are using, especially if it is a socially acceptable drug like alcohol. So the person will tell you that, oh, I don't drink that much, I drink a little. Or the smoking, it doesn't do anything to me. In fact, they'll even give you positive effects. So a lot of young people will tell me that, oh, when I smoke, I feel relaxed. It makes me steady better. So it can be difficult to address the problem. So if you as a young person, you have a friend who is refusing to admit that they are using drugs excessively, it will be good to link them up with an adult that they trust. So the best place is within the school setting. If you have a teacher who they are close to, who they listen to be good to let the teacher know and link your friend up to this teacher so that the teacher can talk to the person. If possible, link the person up to a healthcare provider who will be able to refer them for help. So it's a genuine concern. Sometimes it takes several visits. So even with us health workers, a person may come several times and may have a big problem. So it may be a social problem or a health problem. Then we use that as an opportunity to encourage them to seek help.
Felix wanted to know whether you could have health education in pictorial form so that, yes, he wanted to know. So.
Yes, we can do that. And it's a very important point that you raised. So it's important for us to do that so that everybody's needs are met. Yes.
Okay, more young people, questions? Are my people online also sending questions? They are. Okay, so let me read one online question. Okay, so online. So this is the chairperson of the Pediatric Nurses Association, Evelyn Kuma. Would like to ask if there's any plan to run training workshop for the school health nurses to be abreast with the needs of the adolescents. So that's, Evelyn, a very good question there. Any more?
Thank you. I'm Makoto, a teacher from St. Barnabas. I'm a bit disappointed I've not seen any educationists in the panelists, because the group we are talking about, most of them are in the school system. And the education sector is the policy makers for these children. We were talking about drug abuse or drug misuse. Today, you think it's only smoking weed that is drug. The children we have from basic school, I can say from class 3, the sort of drugs, some even common cough mixtures, they have the purpose for it. And some of them these days, it's not about smoking the weed. It is in almost everything. Their food, this sobolo, the drinks and everything. And the worry is when you get to the secondary schools, the boarding schools, it's not easy. And teachers don't have control over these children. What is Ghana education doing about these menace? Because if we don't take care, it will overcome us in the near future.
Thank you very much. That's something we will take note of. Make sure that they know that they have to be, they are a big stakeholder, because the students spend all their, maybe 1/3 of their day with teachers. Yeah, so it's a good point there. Any more hands? Young people, yes, gentleman in red. What's your name and your school?
I'm Daniel from Osusalem Road Basic. Yeah. My question is that now weed is legalized in Ghana. So does this mean everybody is access to it?
What is the situation on ganja? I'm even confused now. It's not legalized. Yeah, you see, that law is going to cause a lot of problems because it's for commercial purposes. So it's still illegal for personal use. It's illegal for personal use. But it's medical marijuana or medical cannabis? No, not in Ghana. So what is legal in Ghana? Dr. Selassie, this is your field. It's not legal. So what happened to that law?
So it's for industrial use. Yes. So it's not for personal use. No, it's not legal.
So industrial use, what would you use industrial marijuana for?
Hair products, in medicines, industrially, not for personal use.
So it's not legal. It's for industrial use. So I think there needs to be a lot of education by the Ministry of Health and the Mental Health Authority and all those people. Yeah. So that's what you should know. It's not legal. Okay. Any more questions? You. Okay.
Thank you very much. Thank you very much, Isaac, UTV. I wasn't surprised when my junior brother here made mention of that statement. I never knew, even they have names, Luca, GH, Amnesia. What I just want to bring on board is a question and I say another question. If a thief wants to get into your house, he doesn't mind buying 5,000 Ghana cedi gates you bought, because he knows when he breaks into it, he can get more things inside there. There are times that I drive around, I pick the gentleman from La Paz to East Legon. And when we were going, I suspected that he was having something on him. So the next thing I did was, I bypassed the first police post, spoke with them. The next one, I just handed him over. Yes, it is about time. Ghana Education Service. My brother made mention of pictorial things. But if you do the pictorial and then you don't come out with translations, it's going to be difficult. Because language has become a barrier. If somebody is holding rash and you go and take it, you are dead. They are even adding it into our own kontomire. If you go and buy eba and a gushi toffee, we have wheat toffee, cake, others. So it means that we should also look at other fast alternatives to also get abreast with this thing so that we can help our young ones. If not that, we are on a time bomb.
Thank you, sir. Any more young people? Hands are up. Yes.
One of the topics we discussed was about signs that an adolescent should know about mental health. I thought that the explanation, if they can give us the signs. If I am with adolescent, what are some of the signs that they show that will let me know that this person is facing a mental health challenge or something, so that we'll be able to relate with them and then see how best we can help them to address it.
Okay. Yes.
Please, I have a suggestion.
Suggest.
Please, I suggest that the Ghana Health Service, in collaboration with the schools and communities, should often organize adolescent sensitization program in the schools and communities at large for adolescents, since we are a vulnerable group in the society, about our curiosity.
Yeah, thank you. I'm curious about your name. What's your name?
Prince Yeboah.
Prince Yeboah. Thank you very much. Thank you. Yeah. So this is one of the means that we are sensitizing, but you want it to happen to the schools again. I should come again. I'll take two more.
Hello.
Hello. I'm Sophia, pediatric nurse. So my question is, upon all the discussion we are making here, I want to know, what are we adults doing wrongly that predispose this adolescent to some of the preventable problems we are talking about here?
Okay. There's another hand up here. Felix again.
I'm a person in this one. The person that do bad. The activity that you the that Ghana see that do. The why Ghana for material Ghana free life. Do answer be the whole that rules payers that the rule the first state. The rule the mandates love who the bring the do the business us.
He's just saying that since he's also interested in music and dance, if start music and dance, if start programs can also be incorporated in maybe culture, so that as we sing, we educate our peers.
Thank you.
I have a contribution, please.
The questions are many, so I guess we just pick some and ask.
I have a contribution, please.
Online.
Yes.
All right. Yes, where is it?
Yes.
Okay, yeah, go
Good
ahead.
morning. Yes, good morning. My name is Dr. Derry. I work at 37 Military Hospital. I want to congratulate the Pediatric Society for putting this program together. But I think the panel should have included a public health person. I'm a public health physician, and we handle the preventive aspect of medical conditions and people's well-being. So we usually go to the field and we engage this adolescent. With the Ministry of Defense, at the Ministry of Defense, usually we go to the Ghana Armed Forces basic schools to educate them, the adolescents, on their health and well-being issues. And there are a lot of things that come out, and also we also help them out in a lot of things. So my first contribution will be that in future, when we are putting such a panel together, please let's add a public health person, because it's a collaborative approach. We use the public health nurses, the community health nurses who are also under public health to do most of these educations in the schools. They do most of this education in the schools. Even at the Ghana Health Service, there is a community health nurses that go to the schools and handle the school health programs and all that. And they are under public health. So we are a big stakeholder to be left out in a forum like this. And then we handle, it has come out several times that prevention. We usually try to roll out the intervention aspect of the programs that will help these children not to go into the things they are not supposed to go into. So we go and sensitize them in the schools on how not to do certain things. And most of the time they're able to approach us and tell us their concerns. People will approach you and tell you they are being abused sexually by stepfathers, by fathers, all kind of things. And we link them up with our clinical psychologists here in 37. So that is what we do. And I'm sure the Ghana Health Service also does it. It's just that probably we have to ensure that we are training our community health nurses, our public health nurses, and officials that go on the field so that they can do it better. But we have a solid team of adolescent health program and team here. We collaborate with the health promotion unit in 37, and we do it big. So next time, I'm sure we will involve some public health people to also give the aspects that they also handle in their experience. Thank you. With HPV, which I want to talk about the human papillomavirus vaccination. Currently, yes, it's not with our vaccination schedule, but we can educate parents. Some parents can afford. Those who can afford, some don't know they can afford it, but they don't even know that it is possible to vaccinate their young ones, both boys and girls, not to get it. So we should scale up that education also to let parents know that those who can afford, for the time being, they should be vaccinating their adolescent boys and girls, whilst we wait for government to try and add it to the vaccination schedule. Thank you.
Thank you, Dr. Gary. Just so we know, in the second forum, we will have public health specialists on board. We'll have GAS on board. Public health, we have a public health, or we do have one here already. And then we will make sure GAS also comes on board. So quick question for Rachel, and then I'll get answers.
Okay. Please, the first question, how do you cope as an adolescent living with diabetes? So has the illness, diabetes affected your future career or family life? And the last one, any advice or encouragement for your peers or colleagues?
So we'll start with Rachel and we'll get the answers.
As an adolescent living with type 1 diabetes, it gets very hectic sometimes because on some days your sugar levels, you don't know what's happening, but it just won't go down no matter what you do. So on such days, when it gets too much for you to bear, you turn to your friends, your diabetes friends, and your doctors, Dr. Betty and my diabetes youth care member friends here, for help, for support, for inspiration. And then if there's anything you haven't done, maybe they'll suggest something for you to do, or then they'll just motivate you and let you know it will get back to the normal range. And for it limiting my abilities, no, it hasn't limited my abilities, because diabetes is something like a lifestyle disease. And once you accept it, you learn about it and you learn to live with it and know how to manage it. You are as good as anyone without any problems, because you just have to know what to eat and how many units of your insulin to take. Type 1 diabetics take insulin injection as their treatment. So you just have to learn and master the disease, and then you'll be the boss of the disease. Also, what I would like to tell all of you is no matter what disease you are suffering from, be it diabetes or anything of that sort, it doesn't have to stop you. You can go and get your dreams. You can be whoever you want to be, no matter what disease you have. If I don't tell you I'm sick, you won't know I'm sick, because I want to get my goals. I don't want my disease to limit me. So diabetes or any chronic disease, anything can limit you. You can live a very normal life no matter what you have. Thank you.
Okay, thank you very much, Rachel. And I have to say that I work with young people with type 1 diabetes, and they really make it all worth it. I get a lot of inspiration from them. So thank you very much. Okay, so there was a question about what should adults do with all that is going on. In our society, we have a very conservative society. And then there is internet, there's social media. We are seeing a lot of things. The way we were brought up is not what is happening now. So what is important is for us to have an open mind. Let's listen to the adolescents. Let's learn. We are not too old to learn. have to learn about Instagram, learn about Twitter, learn about, all of those things. And you know that the adolescents today have, or young people, they don't even have to get to adolescence. They know everything just about, because it's just a button away. So I would say that we need to also open up our, we should try not to be judgmental. We should open our minds and listen to them. We should communicate, especially parents. Sometimes we think, you see your child doing something and you say, oh, when I was your age, I wasn't allowed to do that. Children are basically seen and not heard. Well, that time is over. Children are now demanding to be heard, not just seen. So this is something that we have to take into consideration. All right, and then signs of mental illness. Okay, so I'll start. So basically, if we all know what our personalities are like. So if you have a friend who all of a sudden is withdrawn, is not interested in what you usually do, then you need to try and find out. Don't just leave them alone. When somebody starts talking about, oh, well, I'm just tired of this. I'm just fed up. I just want to, disappear. And then I don't want to even bother you anymore. You find out that I'm no longer there. When people start making such utterances, let's be aware of that. And also when their grades start falling, somebody who's very good in school, all of a sudden, their grades starts, faltering. That's also something that is a sign. When someone sleeps a lot, okay, they don't seem to want to wake up. They don't seem to be motivated. At the same time, somebody who is quite, affable, all of a sudden becomes very hyperactive. You don't know, they start misbehaving, so to speak. Or someone who doesn't sleep is also a red sign.
Yes, so Dr. Banker has said a lot of the things that I would have said. So the main thing is to know the people around us well, so that when there is a change, we are quick to see it. So most of the things that she has said are about changes in behavior. So if you know that this is how they are usually, and then you start seeing changes in the way they behave, then it's possible that there may be something going on. It may not always be in terms of the low mood and all that. Sometimes they also become excessively friendly, excessively happy, giving out things. Sometimes those ones are not so obvious because they are very nice at that stage. They are so nice, they are happy, they are smiling with everybody, talking about everything, sharing information they shouldn't be sharing. That may also be another type of mental illness. So it's important to know the people who are around us. So once you see changes, you pick that as a sign. That may be a sign. The other way that I've also encountered sometimes is social media, like Dr. Betty has talked about. So these days, a lot of young people post a lot on social media. And sometimes you can pick up signs from the things that the person is posting on social media. I have clients currently that I monitor their social media posts specifically for that. And when I see certain things, I go and check on them. So, and I have had people who have contacted me because they've seen that a friend has posted something that suggests that they are feeling very down or they want to harm themselves in a certain way. So since you are all very active, I'm sure, it's important to check on each other frequently, even if you are not calling or seeing them physically, you monitor them. Sometimes a person is active and suddenly goes quiet. That is also something you have to check on. The person is always posting, but now for 2 weeks now, you've not seen anything of theirs on social media. It may be that there's something going on with the person. Okay.
All right, I'd like to say that today is not a talk shop. We've had a number of stakeholder engagements even prior to this meeting, and our sustainability plan will be outlined later on towards the end of this program so that you know. We unfortunately couldn't get every stakeholder in here, but we have majority and many of us are connected to many organizations. So we know that there will be more done and everybody's voice is heard. If an adolescent today hears something, learns something, we have achieved something, okay?
And we hope that the ripple effect will continue as people move on. This is just the beginning. We are going to work hard to ensure that just as we have been able to do for maternal health, for child health, for all the others that many people constantly hear us talking about, we will do the same for adolescent health until we are happy with the progress that we see. When it comes to issues of illnesses and all that, know that you are not alone. One person may have Down syndrome, another may have mental health issues, another may have diabetes or sickle cell. The beauty of it is that you can't see my problems by looking at my face. Neither can I see yours. If we go into details, we may know that, oh, Selassie Po, she has this, she has that, but you can't tell. Me, Po, I have this, I have that. So you see, you are not alone. No matter what you are suffering, illness or problems, you are not alone. So talk to someone trusted. Your parents are there. Your siblings, older siblings or more responsible adults are there. Your health professionals are there that you can reach out to. Now, as part of this advocacy, we are also hoping that parents will learn. It's difficult for parents to come down to the level of young people because as she was even mentioning certain things, I mean, I haven't heard some of them. So sometimes it's difficult for the adults to come down to the level of the adolescents to understand their language. But we are pleading with the adults or the parents that keep an open mind so that your adolescent will find you as somebody friendly enough that they can open up to you, trust you to discuss their problems with. When it comes to issues of puberty, it comes to issues of sex, the desire to have sex and all the feelings and all that, what to do with it. We as healthcare professionals, as Pediatric Society of Ghana, as SOGOG, Ministry of Health, Ghana Health, will do our bit and empower parents so that they have the information that they need to be able to talk to their adolescents. But we encourage them to also have a listening ear. Now, parents are very busy. For healthcare professionals as well, we are not alone. No? I mean, the people on the call, the people maybe they are not alone. People have issues. So for us all, let us try and make a conscious effort as parents to make time for our children, to listen to them, know what their problems are, know who their friends are, know what their concerns are, so that we can help them.
I just want to speak on the issue of persons with disability. So Ghana Health Service, all our educational materials we have quite a number of them in pictorial forms for adolescents. We also have some of them produced in brailles. The challenge we've had over the years that the materials have been produced, but to reproduce it again because of financial reasons. But I think that at the end of this this program, if we discuss, we'll get in touch with the Adolescent Health Program Manager so that you have them in brailles. We have some of them in audiovisuals. We have some of them on all these areas. We have what we call the info pack. They have been produced in pictorial forms for that. The other thing I want to say is that there's an organization called Right to Play. They're an organization in Ghana who help children in general, and particularly persons with disability, whereby they help them to have issues on sexual, reproductive health, and only issues related to adolescents. They put it in a play form, whereby it can be musicals, it can be in form of interaction games, such that they use that as a means to do. And currently, they're in Ghana, they are doing some project work. I think at the end of the program, if we meet, we'll discuss with the program manager. I think you can link up with them so that we can also benefit from that. Now, what are we doing differently? Are there improvements? Yes. And the person who has the question, are there improvements? Yes. If you heard the UNICEF representative earlier on, the Safety Net program is a program that was done with Ghana Health Service, with UNICEF. And that has been able to ensure that quite a number of girls who were pregnant, who would have dropped out of school, would have, they've been reintegrated back to school. The program was started initially in just about 4 districts, but currently in over 124 districts in Ghana, the Safety Net program is in place. And the main reason is, don't let pregnancy or the problems these girls are having take them out of school. They have become pregnant, they end the pregnancy, they get back to school so that they can get what they need to do done. The other thing, if you notice also, is that the teen pregnancy rate, even though it's gone down and stagnated, there's been a big decline with what we used to have before. The other thing is that there's increased advocacy. Now, at the Ghana Health Service, there's a national technical group where we have an adolescent group nationwide, drawn from everywhere. They meet to help decide on what is happening to adolescents. Are anybody aware of that? Yeah? Yes. So they have adolescents who meet from every region. They meet so that whatever is being done for the adolescent is not just the decisions of the adults, but the adolescents themselves are involved in it. Now, someone asked a question, what are we doing wrong? I think one of the things I need to say is that just the way we prepare for our wedding days, we take time to prepare for it. As when we become parents, we should also prepare ahead for our children at every stage. When they become children, we plan ahead, we buy shoes, we buy clothes for them. Also, when they become adolescents, we need to prepare. It's shown that most young people want to talk to their parents. They want to discuss this intimate issue first with their parents. It's difficult, but can we have a place where parents who are not exposed to it can learn on how to engage them? Yes, they are there. And as for Ghana Health Service, we are ready to engage any group of people to help parents, prepare them to know how to engage their youth, the adolescent, and discuss the matter with them, so that at least that the desire of most adolescents is that I want to talk about sex, but I want to have that discussion with my mother or my father or my guardian. That's their desire. So we want a situation whereby parents are equipped, we can go about it. And then when it gets to a certain point, then the professionals can come in. They don't want us, the professionals, to be number one. The truth is that it's because we are not, as parents, we are not taking our roles. That's why the teachers and the professionals are now coming in to take care of those roles. Thank you very much.
Thank you so much. Time is really our enemy right now, but I just want to acknowledge a couple of people who sent messages in, and we'll deal with the issues. Avugu Wedam Caesar from Northeast Region, Community Health Nurse, talking about how adolescents in rural areas, not in schools, are looking for strategies to employ to help address their needs. There's also one where he says, I have observed personally as a tutor and health worker that the youth have little trust in communicating their sexual life and questions to their. And I think Dr. Emmanuel just dealt with that, how we can build better trust for parents' relationship with the youth. And then Esther Donko Ampong, Pediatric Nurses Group, Ghana, says she wanted to find out what can be done to assist young girls in rural areas who are forced into early marriages. So lots of issues, and time will not permit us to really tackle all of them, but we've taken notes of all your issues. And there's one gentleman who is just wants to share briefly with us. He's an SCD patient, wants to share his experience. He's online. SCD, I believe, is sickle cell disease, correct? He's 14 years old. Caden Boating Usu Ansa. Caden, if you're on, just give about. He's right here. Oh, okay. Caden, what's up? Okay.
Hello, my name is Kaden Boatin Osuansa. I'm 14 years old. I'm a patient of the sickle cell disease. Oh, no. Sickle cell disease is a very, very, I don't know how to put it in words for all of you to understand, but those with sickle cell disease go through a lot, especially when they are in crisis. Like, crisis is when the sickle cell disease affects them in very painful ways. Let's say you haven't taken your medicine or drunk water, and then you go and play with your friends, but you play too roughly. You see them starting like to slow down a bit. They are fatigued, and then you see them sitting down. That means they are in pain, but they're in the early stages. So if they don't take care of it early, when they go back home, they can't even get up. Like when they sit down, they don't want to get up, and then they're excruciating pain. So yeah, that's it for you.
Just briefly before you go, what can you say to encourage people who are, going through SED and other illnesses like that? What can you encourage them with?
Okay, let's see. When your parents or your doctors tell you to drink your medicine, you should actually do it, because the medicine plays a vital role in your body. It helps your immune system protect yourself from diseases, bacteria, and everything that is harmful to your body. And they also have to drink like a lot of water, especially when the weather is not good for them. When it's about to rain, they should be in their sweaters, because their body can't stand the cold temperature. So that's part of it. And then they should take it easy when they are playing. They shouldn't go too roughly, especially when they haven't drunk a lot of water. And then that's
All right. Thank you very much. Well, my co-MC also wants to add up. All right.
Well, I'm proud of seeing this. My brother is an SCD patient. I'm also one, but it's not easy, especially we that you're in the boarding house, especially when it rains. You see people in the rain and that and stuff. You be like, oh, I want to be one. I want to also make fetch water. I want to run some maybe during games, but no, it won't permit you. It's something else. Like sometimes, for instance, when you're in school, games and running around the field, and my madam will call me whilst all my friends are laughing, playing. I want to also join, but it's not easy. You can't, because if you try, you're going to get your crisis. You'll be able to you'll be able to work like the next day. For instance, you do one, you run, but the next day they'll all be normal, and you feel pains. You can't walk, you'll be crying, be in the sick bay. So sometimes you feel that you are left out. But still, we give thanks to God, you drink our medicines.
And I hear you want to be a doctor, right? Dorothy wants to be a doctor. Why?
Oh, I'll be a special doctor for the sickle cell patients, because I feel their pain. Like I know what they are going through.
Thank you so much. We're proud of you. Okay, Kenan and Dorothy. There's one more person who wants to speak, living with diabetes. Just let us know how it is. Yeah, let's share the thoughts. Yeah, give her a shout.
Okay, my name is Nana Droa Ojoyebua. I'm a representative for Diabetes Youth Care. I'm the vice president. So I've been living with diabetes for 11 years now. I had it when I was around 10 years. It's been up and down. It's just not as easy, just like the way the sickle cell people said their own. I have my highs and my lows, and then I hate my lows because we have something called hypoglycemia. That's when your sugars go so low. And then, well, I'm quite fortunate. When my sugars are going low, I see that they are going low, but a couple of my friends don't see that their sugars are going low. So you can even be walking and you just pass out. But for someone like me, I start to sweat, I get tired easily, I go and check, and then my sugars are around 3 or 2. At dawn today, my sugars were around 3 point something. And then I took my insulin last night. I don't know what happened. I just corrected it with something small, and then it went high again. So it's very complicated. It's not easy, but as Rachel said, we have an organization called Diabetes Youth Care, and then we call ourselves Di Buddies. So we have our doctor, Dr. Betsy, we have Dr. Banks, and we have Dr. Printer. We have a couple of doctors, and then our friends call to check up on us to make sure that we are feeling okay. So basically, that is it. So we have a motto: diabetes won't stop us. That's what we always say. We are warriors. We know that no matter what we are going through, we'll definitely sail through. So whatever you are going through, I'll just advise you, it's not the end of the world. Don't let your disease, your sickness stop you from achieving whatever you want to achieve. Thank you.
Thank you very much. Thank you. Yes. Thanks a lot. Really inspiring messages from all our adolescents, bringing us to the end of our forum. Let's appreciate. You want to say one thing? Yes, Dr. Peggy? Dr. Betty, all right.
Yes, I just wanted to take this opportunity. We've heard from our young ones who are living with chronic illness, sickle cell disease and diabetes. And I'm glad teachers are here. I'm glad young people are here. When your colleagues or young people have different diseases, there's a lot of stigma in the school, coming from their peers and coming from teachers and coming from head teachers. I've had to deal with, I get emotional with this a little bit. I've had to deal with students not being allowed to go back to school because the headmistress found out that they are diabetic. It is not their fault. They didn't choose that. So please, let's go and advise ourselves. And I understand that it has to do with maybe ignorance. You don't know about it. The child who has not asked for it has this condition. You are stigmatizing that person. What should that child do? Can they do anything for themselves? So please, let's send this, let's be ambassadors for the health of our young people. Thank you.
Thank you, Dr. Betty. Thank you, Rachel. Thank you, Dr. Selassie. Thank you, Dr. Hilda, Dr. Emmanuel. And we do have Vice President of the Pediatric Society of Ghana to speak to us now with the closing remark. Let's bring Dr. Emmanuel Pong to the stage. He's going to share the plans by the PSG to sustain what we've just started. Thank you.
Thank you. Thank you. Wow. It's been a very enlightening meeting for me personally. I was asked to put together, okay, what next? I think it came up after this forum. What next? We've had such forum before. So what next? I put together something, but I'm going to slightly depart from it because going over the questions, the contributions, the discussions, I realized that there are some of the structures we are considering that are already in place. However, they are not visible. People are not even aware they exist. So for Pediatric Society of Ghana, our vision is clear. We are going to talk, and advocate till everyone, every stakeholder in every child health, adolescent health related issue takes up the challenge and actually acts. And we are not going to stop today. So in the coming months or years, we are going to target certain areas, explore because, for example, I just got to know that we have adolescent clinics in schools, over 500 to 1,000 clinics in schools. For some of you, that's the first time you're also hearing about it. The question is, how do we capacitate them to make sure that they're able to deliver what we want adolescents to have in schools and out of schools? So for us, we'll continue with the partnerships. Someone talked about Ghana Education Service. And then someone, that was Dr. Derry, talked about involving public health. The more I follow the discussion, the more I realize that all the list of partners here is not exhaustive enough. For example, we're talking about how to deepen the partnership with the Ghana Health Service, with Ghana Education Service, all the various agencies, Ministry of Health. But I realize it's not exhaustive. So what are we going to do? Go back to the drawing table. Look at what is really happening. Who can we bring on board? I realized I didn't even capture our media partners. So it is all about partnerships and collaboration. And for us, instead of coming to just spew out what we will do, rather, we want to take a step back and see, take all the inputs, all the engagements that have happened here, and look at which areas we should focus on. Where should we start from? But I'll mention this. It's clear that awareness about adolescent health and well-being issues are not talked about enough. And where is spoken about, where we even attempt to talk about, is adults who talk about it. We have various groups here, various youth groups. And for us, a key plan will be to engage further these youth groups. Let's hear from them. They must have plans. They must have ideas as to how we should address their issues and take it from there. Instead of the Pediatric Society of Ghana coming up with a plan like, oh, we'll do trainings, we'll do workshops, we'll do this. Rather, together with the national executives, I think we won't take a step back, put together these ideas and thoughts that have come, and rather take these ideas from those that we are talking about, the adolescents and youth, and present it at a later time to all of us and all stakeholders, so that we all work together. It's good to have the Parliament Health Select Committee and all the major political actors and players and influencers on board. And I'm sure we'll be able to do something very good. The last thing I want to talk about has to do with even our age stratification system on the national health insurance. So for example, we only have 2 age groups really, under 12 years and more than 12 years. So that means right from the outset, we have overlooked the adolescents. And that's why when you go to the hospital, we have a male's adult ward, a female's adult ward. We have a child health ward. But really, when a 13-year-old girl in her menses comes to the facility to seek care for something else, do you put her in the children's ward or you go and add her to the 60-year-olds? So for us, I think these are all we need to sit back, review, and engage everyone who matters. I almost forgot about HIFRA. So again, I'm just highlighting why we need to really sit back and involve everyone at every level. Because when we put these ideas together, who is going to enforce and make sure that the schools or the health facilities are actually doing what we've set out to do? And we need accreditation and then regulatory authorities like HIFRA to even carry out some of these things we'll come up with. And our panelists, you've done a great job discussing these issues. We are going to put together all these ideas and at a later time, invite all of us. Join wherever you hear the sound. Don't wait for a personal invitation. Join and let's all make sure that this forgotten group of adolescents and our youth are heard and given a presence. Thank you. Over.
Thank you very much, Mr. Okon. Please, you call upon Dr. Gabi Obin Kurantin to give us the vote of thanks.
Thank you. But I think there's someone else who's supposed to give the votes of thanks before I come in to round up. So Selassie. Yes. So when you're done.
Okay, so first of all, I'd like to thank God Almighty for a successful program. I'd like to thank all the organizations that sat down and decided to come up with this program, seeing the importance of educating the adolescents and then involving them in avenues to try to better their lifestyles and their health. I'd like to thank our panelists for taking time out of their busy schedules to be here to give us in-depth information on what is needed and then how exactly we are supposed to navigate the problems that adolescents are facing. I'd like to thank the organizations, International Pediatric Association, the Ghana Health Service, the Pediatric Society of Ghana, for providing us with an avenue to be able to share ideas and then the issues that are bothering adolescents, especially taking into consideration how negligent pardon my language, how negligent the system has been about the nuanced problems that adolescents face. I believe that this podium or this program in of itself is a step towards tailoring decisions and solutions that are going to meet the nuanced disparities that adolescents face, and it's actually going to help in the long run, having trickle-down effect and have the blanket and general well-being of all adolescents, despite the problems that they might be facing. So based on this, I'd say I'm really grateful for this. And I know that all the adolescents here and the kids are also very grateful for the fact that they are now being taken into consideration, and then their problems are being prioritized, and there are solutions that are actually going to help us cater for these issues. So with that, I'd say thank you again for everything, and thank you for this program once again.
You can tell when there's somebody who loves to read books. No, it's more Selassie.
Yes, Mr. Kapede, please take her with her when you are going back to GBC. Yes, it's been a wonderful program, and she's already thanked all our partners. I would just like to highlight a few others. UNICEF, very instrumental in us organizing this program. UNICEF, they always have these agendas dear to their heart. Also, Rich Hospital. So you see this beautiful place we are having our program in today. Rich Hospital gave us their venue free of charge, and they gave us the chairs, water, a lot of things, and we are very grateful to them. Ghana Health Service. So you can see Ghana Health Service logo on our poster. So Ghana Health Service gave us a lot of money. Yes, they said I can say it. They want to be acknowledged, and they have done very, very, very well. And we hope that it will continue. You know, we'll always go and ask for more. Yes, yes. Would also like to especially thank the representative from the Parliamentary Select Team on Gender, Child and Social Protection. That ministry is directly involved with all the issues that we have addressed today, and we believe that take the message that they have gotten from here, and they'll be able to implement all the concerns, all the problems that we have addressed. We'd also like to thank 1.8 billion young people for change. If it wasn't for them, we won't be here today. And so a lot of countries are organizing this adolescent forum, and it is all in the lead up to a main one, a global one, which will be organized next month. So you would all get the invitation to be able to join. So you'll be able to interact with adolescents all over the world. Okay, so we also thank them. We thank our MCs, Mr. Kafwide, he's been excellent. We thank our other MC, Dorothy Sewa, very, very excellent. She's also done very well. And we would like to thank GRNMA, GMA, everybody, all our participants on Zoom. We'd like to thank you, all our PSG members. We'd like to thank our live stream group, yes, Team 1,000 Words. I have to mention that one too. And then the media, what will we do with the media? I mean, after we leave here, if the media doesn't carry the message out, it won't get anywhere. So all our media representatives, we say, are you cool? So let's say our closing prayer. All right. Almighty Father, we thank you so much for today. We thank you for making us gather here today. We thank you for the success that this program has become. We pray committing each and every one of us into your hands, all the adolescents, all the problems that they are facing, Father. We pray and ask that all the things that we have discussed here will be able to help them, that the solutions that we have come up with will be able to implement. We pray committing all the organizers of this program into your hands, all the panelists, the MCs, every single person who has made today come to be. We pray and ask that as we leave here and go back to our various destinations, you will carry us on our journeys so that we would meet again someday soon and have all the cause and glory to give you the glory and the praise that you deserve. In Jesus' name, we have prayed with thanksgiving. Amen.
Thank you very much. We've come to the end of our program. We'll take a nice big group photo So our high table will come to the front. We'll bring your chairs. You sit down in front of the table, and then we will gather around them and take a nice group photo. So please stay. If you don't take the photo, you can't go home. Okay. Yes, a bit backwards. Back here. Yes. We'll push this table back. So our panelists will sit. So our panelists will sit down. They'll come behind you, yes. Yes. Boss, this is a good arrangement, right? And then we'll have some stand behind them. He's the president. The same order that we had, yes. Presido. Okay, so this is the panel first. Nurses, please stand. Nurses and midwives, please stand by. Stand by after we take the first one. Yes. And all partners, doctors and nurse, medical professionals, please join them after this. He says, please remain seated. Doctors and nurses, medical professionals, please join them. Yes. Behind them. Yes. Thank you very much. Hey, there are plenty here. So medical professionals, nurses, doctors, school children, stand by. Okay. Ministry of Health, stand by. Okay, next is the Ministry of Health. Wait, hold on. Okay, Ministry of Health, you're next. Ministry of Health. Ministry of Health, please join them. Yes. Oh, that was the Ministry of, okay, so Ghana Health Service. We're all the same. Okay. Ghana Medical Association. You're all here. Okay. UNICEF, is UNICEF here with us? They are online. Panelists are there. Greater Accra Regional Hospital, Rich. Rich is here. Yes, Rich, please join. Rich, please join. Diabetes Youth Care, stand by. Diabetes Youth Care, stand by. This is Rich. My younger brother was born here. Should I come and stand here for him? My two brothers were born here. Yeah. Rich. Diabetes Youth Care, you are next. Diabetes Youth, wait, one more for Rich. Diabetes Youth Care, please join. Selassie and squad. Yeah, he came for it. How about yours? Okay. All right, Diabetes Youth Care, this is you. What does SOGOG stand for? Society of Obstetricians and Gynecologists of Ghana. SOGOG, are you around? This is Diabetes Youth Care first. My brother joined them now, Abi. Okay, SOGOG, are you here? SOGOG, Society of Gynecologists and Obstetricians, Ghana. They're done. Okay, let's go. International Association of Adolescent Health. Kole Klote, Special School Students and Teachers. Kole Klote. Special school, yes, let's have the special school. Other students, stand by. Can we just have all the children together? All the schools together. All the schools surround the panelists. Yes, you're not that many. Yes. All the schools. And well, their teachers will come later. This one is for the students first. Students. Teachers, stand by. Teachers to stand by. We'll do teachers after. Yes. If you're a student, join. Bro, you can stand on the chair if you know get the angle or you're good. Are you good? Okay. There's some space there. Yes, fill it, fill it. Students all together. Thank you. Is Sickle Cell Youth Group here? Yes, okay. Young Leaders for Change Foundation, are you here? PSG executives, PSG members, stand by. Committee members, stand by. Youth community, stand by. Students, smile. Youth for Change. Hey, what's our slogan again? Hey, I forgot it. Young people for. Young people for. Babala, take one when they are saying it. Young people for. Yeah, put your hands in the air. Young people for. There you go. Please have a seat. Young teachers for. Teachers, you're on now. Students can sit down. Teachers will come. Teachers, all teachers. GES was not here, but you represented them. Yes, the teachers were here. They listened. Teachers, all teachers from all the schools. Whether you're wearing a smock or a jacket. All teachers, all teachers. All teachers. PSG executives, stand by. We have only 3 more to go. Okay. Yes. These are the teachers. Are the teachers smiling? Yes, they're smiling. All other invited guests, I didn't mention your name specifically, but you are special to us. All guests in the house. If you haven't taken a photo yet, please join us. Dr. Ekremet. Yes. Guests. Guests. Yes, you're a guest. You work here, but you're a guest. Yes. Everybody has been covered now. PSG, stand by. It's not the football team. PSG. Is that okay? Yeah, solid. PSG, Pediatric Society of Ghana. PSG. PSG, it's your time. PSG, we need you. PSG executives, PSG members. Is this members? Hilda, this one is members. Members. Okay, PSG members. PSG members. PSG, give us a PSG smile. Yes. Now, do we have PSG executives around? Madam President, do we have your executives around? PSG executives. Committee members. You are the last but one set of photographs to be taken. Committee members, where are you? Okay. Committee members? Is that it? Same people. Oh, committee members. Come, committee members. Committee members, committee members, committee members, committee members. The space here, committee member. Yeah, we are ready, committee members. Okay, please take your seats. Last photo, MCs. Let's go. Shout outs for my co-MC, man. She did a good job. So where will you stand? We should. Thank you, ladies and gentlemen. Have a beautiful remainder of the day. And let's keep the issues on the front burner. The National Forum on Adolescent Health and Wellbeing. Young people for... We have to sign out now. So my MC, come, me and you, we have to sign out. So wishing you the best of the day. God bless. We thank our online people as well. I hope they were taking photos. My name is Kafui Day. Happy to have been your co-MC.
Dirty Sewa. Happy to be your assistant MC for the program.
Thank you very much. Bye-bye. Let's take a photo. Boss, we need our photo now. Yeah. So,